Hello everyone, I am back with a new video. This video is going to talk about the cardiovascular system overview in general, just a little bit of review about the heart and all the things that go along with that. So if you're looking for specific diseases, I have more videos on that, okay? But this is just a review on the cardiovascular system. So let's get started. So it's one of my favorite topics. So you're going to see me when I talk a little excited about what I'm discussing. So the heart is basically, as a review, is a muscular organ that has four chambers: the right atrium, right ventricle, left atrium, and the left ventricle. It's about the size of a fist. Okay, so it's not really a huge organ. However, it can get larger because, again, it's a muscle, and so the more you work, it could enlarge. It's located between the mediastinum, so kind of like right here in the middle of our chest. Has three layers: endocardium, myocardium, and epicardium. And it has this little fluid around the walls of those layers to kind of cushion and protect the heart. It has four valves, and we're going to talk about those in a few slides down. And it also has the coronary circulation, basically the blood that gives nutrients and oxygen to the muscle. Between those valves, I forgot to mention, you can have incompetent valves where blood flow regurgitates, or you have this, what we call murmurs and whatnot. So anyways, that's just a brief review. Here are the layers kind of in between the muscle. Then you have your right atriums and your ventricles in a show of how the fluid kind of cushions that muscle. And this is kind of like the flow, how everything kind of goes. So pretty much blood comes from the inferior vena cava, from our lower part of the body. It basically flows into the right atrium, goes to the tricuspid valve, which is in between the right atrium and the right ventricle. That's usually when it closes, that's your first lub, or the lub dub that we hear when we are auscultating. That's your lub. Then it falls into your right ventricle. From there, moves on to the pulmonary valve up to the lungs. It gets oxygenated, the blood, gas exchange happens, and then it dumps it back into your left atrium. From the left atrium, goes through the mitral valve up to your left ventricle. And this is where the most ejection or the contraction happen that pumps it out of the blood. It goes to the aortic valve, out to the body. When the aortic valve kind of closes with the pulmonic valve, that's the dub. So that's kind of the flow, and this comes really important whenever we talk about certain diseases in the cardiac system, because I'm going to refer back to basically this flow of how the blood travels to the heart. So review this and keep it handy. Here's your little bit of the coronary system of the heart that supplies blood. And then you have your cardiac conduction system, basically the electricity of the heart. Our main pacemaker of the heart is our sinoatrial node, which is located right in your atrium. And this is kind of I'll refer to the SA node when we talk about dysrhythmias. The AV node, where is it located in this photo right here? The atrioventricular node, it's our second pacemaker. So let's talk a little bit about pathophysiology. So we have heart rate, which are the number of contractions, beats per minute that the heart basically performs. It normally ranges between 60 to 100. Now, you're going to hear me when you visit the dysrhythmia lecture that sometimes a normal heart rate for some people, it's not specifically 60 to 100, you know. Again, certain individuals, depending on what they do, depending on what kind of medications or diseases they have, we could consider it what is normal for the individual. However, textbook normal, it's 60 to 100 beats. Then we have the systole, which is the contractions of the muscle, of the heart muscle, that basically pushes blood out to the ventricles. So that's what that systole means. And disystole is whenever the muscles relax and they get filled back with blood. Then we have something called stroke volume. This is basically the volume that is pumped out of the ventricles in a single contraction. So in a single beat, how much of blood is basically coming out of those ventricles? You have something called cardiac output, which is the kind of like the total amount of blood that is pumped out of the ventricles in 1 minute. And there's a little mathematical multiplication here. Stroke volume times heart rate is what gives you cardiac output. And normally we have about 4 to 8 liters of cardiac output that is being pumped every minute. So I like to say that because a lot of people, you know, they cut and you can see a big old spill of blood, and then they're like, oh my God, I'm dying. I'm losing all my blood. But no, really, I mean, we have more than just that in our body. This is also going to be very important for you to understand what cardiac output is. Because a lot of the things in cardiac are surrounded or affected or affects the cardiac output. And if we don't have blood pumping around the organs in our body, we come into trouble. Let's talk about the risk factors of cardiovascular diseases. Well, we have non-modifiable and we have modifiable risk factors. So unfortunately, we cannot modify our family history, our gender, how old we are, and our ethnicity. But we can modify what we eat, how active we are, the amount of stress that we have in our life, if we smoke, drink alcohol, if we develop diabetes or not, can we get it under control? So those are modifiable risk factors. And yes, all these affect the cardiovascular system. Let's talk in general about diagnostic testing that are frequently used for cardiac diseases or to rule out or diagnose cardiac diseases. Few of the tests, and let me just kind of tell you, I have the book right in front of me. These diagnostic testing are in page 669. So I would look at these and kind of just familiarize with what they are and also what kind of nursing responsibility we have. So we have the chest x-ray. We talked about in respiratory what a chest x-ray is a visual radiology of your chest, but you cannot, not only can you see your lungs, but you can actually see the size of the heart. We have the electrocardiogram, which is basically a visual of the heart, kind of like an ultrasound, but of the heart. And I'll show you a little picture in the next slide about that, the difference between the cardiogram through your mouth, which is the transesophageal echocardiogram, or we abbreviate it as TEE, versus the just out of the body through your chest echocardiogram. Then we have the EKG, the famous electrocardiography. Basically, this is the electricity of the heart, and we're going to be talking about EKGs in the dysrhythmia chapter. Then you have the stress test, where basically you have the individual getting on a machine or a bicycle. They are attached to electrodes, and then it kind of sees your electricity and what rhythm you have. And last but not least, you have cardiac cath. We do it in the cath lab, where, let me show you here. where basically the doctor goes through your groin. They could also go through your wrist and put this flexible catheter up to either any vessel, any artery that you want to go. It could be peripheral or in the heart. And basically, it's mainly done or frequently used for people that have blocked arteries in the heart. In depth, we'll talk about all these in the next videos when I talk about specific diseases that utilize. But in general, I just wanted to talk to you about what they are. So when you're seeing them in the book, you're like, oh, okay, she did mention. So see, this is the kind of through the chest, like just a sonogram. And then the TEE, you go through the mouth, through the esophagus, and then you have a picture from inside out. Same thing, a visual sonogram. Okay, let's talk quickly about laboratory diagnostic testing. So yes, they can do a CBC, complete blood count. Basically, you're looking at red blood cells that carry your oxygen molecule. You're looking at your hemoglobin. Sorry, I meant to say the hemoglobin carries the oxygen molecule. The red blood cells just it's what has the hemoglobin. Then you have your PT, INR. These are coagulation laboratory testing. So those come out handy to see if maybe you're too coagulated or too liquefied, I guess, in case that you're bleeding. You also have cardiac enzymes or biomarkers. These are the most common one that we use is troponin, and basically saying if your heart is stressed or lacking some oxygen. This it's very commonly used for people that we are trying to see if they have a heart attack. You have erythrocyte sedimentary rate. They're used mainly for inflammation, but these are just inflammation in general. They're not specific to the heart. We use sedimentation or ESR for other diseases as well, but just know that when an ESR is taken, we're looking at inflammation. We have electrolytes. You're going to soon learn in our dysrhythmia video that electrolytes play a big role in dysrhythmia. So especially potassium. We need potassium. Potassium can be very dangerous to the heart. We also can pull out serum lipids. This is just to see if you have plaque and atherosclerosis in your vessels. Arterial blood gases. We talked about these in the acid-base imbalances. So again, if you have someone that is not breathing correctly, you might do a ABG. And then we have this very interesting peptide. It's B-type natriuretic peptide, or we abbreviate it as BNP. And basically, we use this to diagnose congestive heart failure, because when congestive heart failure, when we talk about that lecture, you're going to learn that the heart stretches with the amount of fluid. And so that stretching of the heart releases this peptide. And so it's very important. And then you have the C-reactive protein, or CRP. And it's also an inflammation marker. But again, it is not specific to the heart. We also draw it for other diseases, and you're going to hear me talking about it when we talk about the musculoskeletal system. So C-reactive protein and the sedimentation rate are for inflammation. The lab on the book is in page 668. So I would definitely review that. There's some levels for BNP, what's normal, what's not normal. Also for cholesterol, troponin, CRP, and all that. So you kind of need to know what's normal and what's abnormal for all the lipid panel, your electrolytes. your inflammation markers, your cardiac enzymes, and everything else. And also your labs like CBC and hemoglobin, red blood cells, platelets, etc. Okay, I hope this was helpful. Again, a very brief review, but I'll see you in the next video for more diseases. Bye-bye.